Good day everyone, my name is TAI and my metric number is S74400. Today, I will present pandemic diseases, lessons from COVID-19 and future preparedness. In this presentation, I will explain the key biological concepts behind COVID-19, analyze how those concepts produce the real-world outcomes we observe, compare recent examples and data, and finally outline clear lessons for future preparedness. COVID-19 is caused by the virus SARS-CoV-2, a single-stranded RNA virus in the coronavirus family, first identified in late 2019. The virus has a surface spike protein that binds to the ACE2 receptor on human cells, primarily in the respiratory tract, which enables the virus to enter and replicate. This molecular interaction is central to the infection process and helps explain the respiratory symptoms and the pattern of tissue involvement observed in patients. After viral entry, the host immune system mounts two main responses. The innate immune system provides an early, non-specific defense that often produces fever and inflammation. The adaptive immune system then produces antibodies and activates T cells to clear infected cells. In some individuals, the immune response becomes excessive, resulting in what clinicians call a cytokine storm. This uncontrolled inflammation can damage lung tissue and cause multiple organ failure. Understanding these biological concepts inform medical interventions. For example, mRNA vaccines were designed to present the spike protein antigen on the immune system, enabling a rapid protective response without exposure to the whole virus. The biological features of SARS-CoV-2 shaped the pandemic's course. High transmissibility, pre-symptomatic and asymptomatic infection, and airborne spread led to rapid global transmission. Public health measures such as mask wearing, physical distancing, testing, isolation, and quarantining were therefore essential to reduce transmission while treatments and vaccines were developed. Vaccination had profound real-world effects. Modeling studies suggest that vaccines prevented many millions of deaths in the first year of global rollout, demonstrating a powerful translation from biological mechanism to population-level impact. However, viral evolution complicated the picture. Variants with mutations in the spike protein often became more transmissible and sometimes reduced vaccine effectiveness, which create challenges for public health responses. Let us consider key data and examples. Clinical trials show high vaccine efficacy. The Pfizer-BioNTech vaccine produced strong protection in clinical trials, and the Moderna vaccine produced comparable results. Population data from global datasets tracked by organizations such as Our World in Data support the scale of vaccine deployment and coverage differences between countries. Policy-level analysis highlighted inequities. The COVAX mechanism sought to promote equitable access to vaccines, but persistent disparities in access and distribution were documented. These contrasts demonstrate how scientific success at the bench and clinic can be limited by logistical, economic, and political factors at national and global levels. Lessons for future preparedness. From this analysis, we can derive clear lessons. First, early detection and robust surveillance are essential. Investments in genomic sequencing and real-time data sharing permit rapid detection of variants and guide public health action. Second, flexible vaccine platforms, including mRNA technology, should be prioritized and scaled because they enable rapid development for novel pathogens. Third, global cooperation and equitable access must be strengthened. Pandemic preparedness requires mechanisms that ensure fair distribution of countermeasures. And the last, continuous investment in health system resilience is necessary. This includes workforce training, supply chain robustness, and surge capacity planning. In conclusion, the COVID-19 pandemic revealed the scientific strengths we possess and the social and systemic weaknesses we must remedy. The biology of SARS-CoV-2 underpinned clinical outcomes and rapid scientific response delivered life-saving vaccines. Yet global inequities and gaps in preparedness limited the full potential of those innovations. By learning from the pandemic and adopting the lessons described, we can build more resilient and equitable systems that will better protect humanity from future pandemic diseases. Thank you for listening.